Yes, now we're good. Okay, okay. Deep breath. Oh, it's been one of those days already. Like, okay, hold on. There we go. Okay. Sorry about that, but we're hold on, too low frame rate. Why? What? It's going to be one of those days. Hold on. Okay, they're both running on the same network. That is never good. Okay. Let me look at this router. Hold on. Oh. Well, the router is on. Let's just see what happens. If it's meant to be, if it's meant to be. If it's not meant to be, it's not meant to be. All right, so let me introduce myself. My name is Jill Osborne. I'm the president and founder of the Interstitial Cystitis Network. I do live national and international support group meetings here on Facebook and YouTube once or twice a week. My goal in doing these meetings is to educate you, empower you, but most of all, give you hope, give you a safe place, give you a place where you know we care, that we're here for you, that we're here for you for free. How's that? Because we all have to understand that our ability to get through the challenges of life depends in great part on the people in our lives. And I want you to feel like you have a place where you can come to ask for some help and ask for some guidance and all that sort of stuff. That's what we do. I bring to you 3 college degrees. I've got a degree in pharmacology. I got a chemistry degree first, then I've got a pharmacology drug development degree, but I love animals. Couldn't do it. Couldn't do the animal research. I was talking to, who was I talking to about? A clinical trial director wanted to know why I wasn't doing pharmacology. And it's like, sorry, I love animals. Can't do the work. Not going to do unnecessary animal research and harm animals. It just is the way it is. All right. Master's degree in psychology and the IC network was indeed my doctoral dissertation proposal, rated #1 in the world in 2 peer-reviewed studies by Harvard Medical School and the University of London. So we're doing okay, but it's not about me. It's about you. How are you doing today? How is life? How is your IC? How are you sleeping? How are you eating? How is life going? The gorgeous spring day here. Allergies. I feel my pelvic floor a little bit this morning. Sometimes I get this weird high-pitched vibration in the bottom of my feet, and that's from pelvic floor muscle squeezing nerves up in my pelvis. So I've had that going on, and I keep saying to myself, okay, you're going to get up early, and you're going to do your internal pelvic floor work. And do I do it? Nope. I get so busy doing other things, I don't do it like I should, and it's very, very frustrating because I should be doing that. Discipline, right? But I will get to it eventually. So one of the big things that happened, okay, so 2 big things have happened in the last week. I've been telling you guys about all the IC clinical trials are kicking off again. So what is a clinical trial? A clinical trial is your opportunity to get free medical care from some of the best researchers in the world. The purpose of a clinical trial is to make sure that the treatment, hi Diane, hi Caroline, to make sure that the treatment they're studying is safe, that it shows effectiveness, and it's all about getting to that FDA approval process. So when you participate in a clinical trial, it's not just for you, you're actually helping the entire IC movement. you're helping that next generation, because if we didn't have patients participating in clinical trials, we would have nothing new. So again, now that COVID is on its way out, hopefully, although my best friend is currently going through a COVID scare, the clinical trial companies are ramping back up. We're working with more companies now than I've ever worked with ever. We sent out our first clinical trial announcement yesterday. It is for a phase 1 study. A phase 1 study means they're establishing baseline data. I can't tell you about what they're studying. It's their job to tell you about what they're studying. Oh, here, hold on. How you doing, Dad?
No.
Oh, honey, check your... Guys, hold on. He's had an accident. Honey, you have leaked all over your pants.
Huh?
Your pants are sopping wet.
What?
Your pants are sopping wet. You got to change your pants. It's, honey, I can see it.
Okay.
Okay. Sorry about that. Okay, so, Facebook streaming software went off and on there. So a phase 1 clinical trial is the foundational trial. That's the trial where they're establishing basic safety data and dosing data. Once they get through that successfully, then they go to phase 2. And then they will go to phase 3. And after phase 3, that's usually enough data to get yourself through the FDA approval process. So for the first time in recent memory, we have a phase 1 study of a fascinating and potentially promising new treatment. And I can't say anything else about it. They have to talk to you about that. What makes the study interesting is that you have to stay at the clinical trial center. It's about a 6-week study. So you would be there for many, many days. A lot of blood draws because they're watching the medication and what it's doing in the bloodstream, if anything. But what makes it compelling is that they are willing to pay up to $20,000 per participant. It's in Ohio. So if you're on the IC Network mailing list, that went out yesterday. And if you want more information about it, you can let me know. And hold on. It looks like we're having internet stuff going on. Very weird. Okay. Guys, it's one of those internet days. Our next study is going to come out this week, and I'm not allowed to talk about it on social media at all. So you can make sure that you sign up for the IC Network newsletter, and you will get that next one. Okay. Now, the other thing, now you guys, for you on Facebook, is this stream okay? Because it's looking really rocky to me. Stoppy and starting. How are you guys doing on Facebook right now? Is this stream working at all? Hi, Kay. Eliza said, I wanted to tell you what happened after treating my Hunner's ulcers with Elmeron on top of the heparin. Had a setback. Lots of pain that same day. Well, yeah, bladder installations are not really treatments for Hunner's lesions. So, you got big open wounds and you're putting potentially irritating chemicals on those wounds. That's why they normally have lidocaine in there, because the lidocaine at least numbs the wounds, right? Sam, recently diagnosed, had vulvar burning for 15 years. On 100 milligrams for 15 years, stopped a couple months ago, and after sex in January began horrible urgency, frequency, no periods for 3 years now. Been on the IC diet for 3 weeks and no changes on bladder builder, omega, magnesium, and D-mannose. You also have DIV and BV. Okay, I know what BV is. What's a DIV? Let me look it up. It's not registering here. Ooh, what on earth is going on with this internet? You know, the internet took a beating with the storms. It doesn't say. I don't know what DIV stands for. Could you let me know what that stands for? Sam says, any specialist in Florida that you can recommend? Florida, unfortunately, is not a viable state right now for really good cutting edge IC care. And it hasn't been for years. One of the reasons why is because their reimbursement rate's so poor that most good doctors leave Florida. So a lot of Florida patients actually make the trip up to see Robert Evans in North Carolina at Wake Forest. Okay, I see you guys on YouTube. Can you guys do a check-in on YouTube and say something in the chat so I can make sure that's working? Okay. Sam, kind of getting back to you, the vulvar burning for 15 years, we would really be looking either at pelvic floor dysfunction, squeezing nerves, or we would be looking at estrogen atrophy. Hello, Deb from Canada. Nice to see you, hon. Disquamative inflammatory vaginitis. Holy. Disquamative implies that if the squamous cells of the vaginal wall are not doing well. Severe aerobic vaginitis. Wow. You don't see that every day. Wow. It's inflammation, not infection. With DIV, the cells that line your vagina become irritated, red, and inflamed. This inflammatory reaction causes symptoms like increased vaginal discharge and itching. This is from the Cleveland Clinic. Can be painful. Cause unknown, although it's associated with vaginal atrophy when your vagina becomes thin and dry. So sometimes, Sam, you know, when we think about the concept of estrogen atrophy and skin atrophy, we think about, okay, what does the skin need to produce that nice thick coating of mucus? And well, what it needs is estrogen. That generally we see atrophy as estrogen levels drop. So the question then becomes, why are the estrogen levels dropping? Well, birth control, Lupron therapy for endometriosis, hysterectomy, where they've taken ovaries, and then perimenopause or menopause. And I worked a couple weeks ago with somebody who was in major perimenopause at like 36 years old. And her mother had gone through perimenopause that young too. So there's kind of there's genetics that influence when we go into perimenopause. For some of us, it's later. For some of us, it's earlier. And so that's why we women, we always have to be thinking about our skin health. Like, for example, for me, I'm starting to feel a little bit more vaginal itch, kind of prickliness, which always tells me that I need to use my internal estrogen. Generally, I use my internal estrogen externally rather than internally, but I can always tell when I'm hitting that point where those estrogen levels are dropping significantly. Sam said, you tried the estrogen, it made your frequency and urgency worse. Have you ever heard of that? Rarely. Every now and then that comes up. But how? Okay, so number one, understand that if you're super, super dry, and clearly you have to be super, super dry, your skin is wide open. You don't have that nice thick coating of mucus that normally gives your skin that protection it needs. And so anything you put on that skin, even estrogen cream at first, is going to be uncomfortable. And estrogen cream is generally quite warm. It will feel hot. It will feel like it's burning you. And understand that it's not burning you. What it's doing, what that's showing is the quality and health of your skin. And every subsequent time that you use that estrogen, it gets better and better and better and better. So how many times did you use the estrogen, hun? Because you may be misinterpreting that discomfort that happens when you start something like that, especially if you're really, really dry. But understand that every subsequent time you use that estrogen, it gets better and better and better. And so Deb here on YouTube, so we're simulcasting on Facebook and YouTube. Hold on. So Deb says 8 days, not enough. Not enough. Not even close. And listen, I've worked with some ladies who by the time they're in their 80s, they've got like dry potato chips as vulvas. They're in so much pain. And so, okay, Sam says, hold on, I just couldn't take having to urinate every 15 minutes while you were using it. Sam, were you using Premarin? Were you using a brand name estrogen, just out of curiosity? What was the source of the estrogen? You could have been having a reaction. You could have been having a reaction to the formula. Donna says, it was so great talking to you this past week. We discussed an estrogen cream. I went to make sure asked my doctor for the right thing. I requested Estrace, but she asked she send it to the Women's International Pharmacy that they can make the compounded. Right. That's it. It's the scientific name is estradiol. Okay. So anyway, hold on one second. So I'm going to get back to Deb here for a moment. So Deb says, I have estrogen atrophy. Diagnosed with breast cancer last fall, so currently not using any estrogen cream. Would bladder builder or Cystomed help out? And the answer is yes, absolutely. Because think about it here for a moment. Even with estrogen, you're never going to have a 20 or 30-year-old bladder anymore. We have to accept the fact that we are older and our skin is not quite as strong as it used to be. And that includes externally and internally. And so your bladder wall is never going to be super, super thick and robust. It's always going to be a little bit on the thinner side, even with that little bit of estrogen. So this is where doing something that will give you a protective coating effect makes a bit more sense. Because if we give that bladder a little bit of extra cushioning, for lack of a better term, extra layering, for lack of a better term, then we're going to help that skin defend itself a little bit more. And so this is where estrogen used to shine, because estrogen was the equivalent of a chemical Band-Aid. But now we know that, Elmeron, not estrogen, Elmeron. This is where Elmeron shined, because Elmeron was the equivalent of a chemical Band-Aid. But Elmeron is now associated with eye disease, so it's kind of off the table here for many, if not most of us. And so this is where we turn instead to either you can do a heparin lidocaine or even Elmeron lidocaine bladder installation, where all the meds go right into the bladder. You're not swallowing it. It's not going through your bloodstream. Can't get to your eyes to any great degree. So the most logical transition is to either go to a bladder installation or to go to a chondroitin-based supplement. Chondroitin is essential to the superficial integrity of the bladder wall. The bladder wall has chondroitin molecules in it. And we had a research study a couple of years ago which said that the single most important ingredient in an installation in Europe was chondroitin, because of its importance for the bladder wall strength. And so we apply that to supplements. The supplements that are going to be the most effective are the supplements that are based on chondroitin. In contrast, let's think about aloe, which has certainly been around for many, many years. The IC Network sold it for many, many years. Aloe is soothing. Aloe feels good on a burn. Aloe can feel good on a vulnerable bladder, but it's not, the bladder is not made of aloe. The bladder is not made of plant material. The bladder is, so I always look for something that has what I call a constructive effect. And the chondroitin has a constructive effect. But if you're flaring, aloe certainly is reasonable. We have a great aloe product in the IC Network store called Aloe Path that I really like. Quite a few patients are using that for flares now, pretty successfully. So she wants to know which one would be better, Bladder Builder or Cystomend. Cystomend, do I have that on my shelf here? I do. So she's talking about Cystomend. And Cystomend is definitely the strongest, most robust chondroitin formula on the market today by far. So a lot of patients who have gotten off Elmeron have switched over to Cystomend. And so it's got the chondroitin for the bladder wall. It's got quercetin as the antihistamine. Bladder Builder is, however, I think, the best supplement on the market because it has the most methods of action. It has a lot more ways that it can help you. So this is really just for the coating effect. But this has the same coating ingredients, but it has more ingredients in it. It's got beneficial probiotics in it. It's got some essential amino acids, but it also has PEA in it for pain relief or for calming nerves down. Neuropathic pain. That's what the researchers agree that PEA is the best for. So if you don't have pain, then doing this makes sense. But if you're also struggling with more pain, then doing this would make sense. They've both been out for about 3 years, and not every supplement works for everybody. There's no way of saying what's going to work for you. This is the blessing here is that we have supplements. I was working with another team of doctors who are trying to come up with a new line of supplements. And it's very, very interesting what they're doing. I give them a lot of feedback, and some encouraging and some discouraging. So Sam said, first you did the generic and then you tried a compounded one. Was it in cream or was it in an oil? The Women's International Pharmacy based in Arizona is really, really good working with patients who are super, super sensitive. That's who I use. They don't pay me to say that. It was my own doctor who told me to use them. So baffling, definitely baffling. Very, very baffling. All right. I do also want to talk to you guys. Now, I'm happy to take your questions if you have questions. And Donna, thank you so much for the 99 stars. So appreciated. Hello, Renee. Diane says, I use estriol 1.25 milligrams as compounded with Aquaphor. Would this be preservative-free in general and gentle? I think so. As long as you can handle the stickiness of the Aquaphor. Do you have the petroleum jelly Aquaphor? I would personally find that a little annoying. I don't like sticky things down there. But Aquaphor is good. I don't remember. Hold on a sec. The question is it better than, say, olive oil? Let's see if Aquaphor has parabens in it, just out of curiosity. Hold on. Hey, don't bend over. the 100-year-old, really bad GERD. It's already had him almost crying once this morning, and now his sphincter at the top of his stomach doesn't work. So anytime he bends over, and he keeps doing it. He keeps doing it. It's so frustrating. And he won't take the meds that the doctor wants him to take. He's scared of them. Okay, I'm just looking for the ingredients for Aquaphor, just out of curiosity. Petrolatum in it. Okay, here we go. Mineral oil, sericin, lanolin, alcohol, panthenol, glycerin, and bisabolol, whatever that is. Bisabolol. The alcohol might be a little tweaky. I wouldn't really want to be putting alcohol on my vulva, especially a dry vulva. Renee says, I have that. It's awful. Hi, Boria. Nice to see you. Deb said, I've used Bladder Builder, but I don't think I was consistent enough. May try Cystamin, but not available here. Sorry to say, but IC Network shipping charges are really high. Deb, they're not our shipping charges. They're U.S. Postal Service shipping charges. In our store, the software links directly to the Postal Service. We have no influence in pricing at all. That's straight from the postal authorities. So, and they just raised the prices another 10% in January. They say 5%. It's really more like 10%. Understand too that the way that the Postal Service is making money is not with letters, it's with packages. So anything over 13 ounces, you are hit like a beast with prices, and we can't do anything about it. I'm so sorry. I wish we could. What a lot of Canadian, I'll tell you what. So for anybody international watching this, if you're in Canada and you're along the border, I'll tell you what a lot of Canadian patients do. They just come across the border and they get a PO box in the U.S. and we can ship it directly to the PO box. And sometimes neighbors get together or girlfriends get together and rent a PO box together, so that they can get all their shipments and then they just drive them back across the border. So that's one thing you can do. Another thing you can do is just, hopefully by now you've developed some good friends here in the US. And so you could, if you trust them, you could ship, and I'm thinking of a group of women that I work with who are over like on Prince Edward Island. They have a friend in Maine. And so we ship all their products to their friend in Maine, who then ships it to them. Yeah, Deb says you didn't know that. Thanks. You ship it to your American cousin. Exactly. That's exactly what you want to do. It's just so, I mean, understand that postal services around the world are just dying. They're just dying. They just don't have, they can't compete with UPS and FedEx and all the freight companies. And so as their business has gone down, they have to raise the prices to pay for all the retirement benefits and stuff. Hold on. You mark my words, he's going to do it. He's going to bend over in the bathroom. It's going to happen again. Elise says, if one doesn't have Hunner's lesions, can mild to moderate bladder inflammation be observed from a cystoscopy without hydrodistension? Sure. And we're going to see that probably the most in the IC subtype 2 bladder wall driven, chemical irritation of the bladder. So if you're drinking a lot of diet soda, a lot of green tea, especially if you have estrogen atrophy and your bladder can't protect itself, that's going to become a red inflamed bladder. Absolutely. So that's really the context where we would see that the most. Hey, Laura. Diane says, I was reacting to the first ointment that the estriol was composed with, so my uro said Aquaphor would be better, but I don't think I'm doing well on this either. I feel irritated down there. I have, here, hold on. Let me go get mine. Hold on. Is everything okay in here? You know what I want you to do today? Every 2 hours, chew a Gaviscon. Every 2 hours. Let's just be very steady and consistent. Let's see if that makes a difference. Okay, so let's see here. Oh, that's my mom's. No wonder. So mine said something like propylene glycol free or preservative free. Isabel says, what are the symptoms of Hunner's lesions? Well, blood, you can have a lot of blood in your urine, severe pain, extreme diet sensitivity, and up all night with frequency urgency, because these are the patients who have visible bloody wounds in their bladder. Hold on. I'm sorry. Hold on. You okay?
Yeah, I don't.
Okay. Laura said, bladder installations gave me the worst UTI I've ever had and took 3 courses of antibiotics to get rid of it. Since then, my IC symptoms have been worse. Wish I'd never done them. Yeah, you know, the challenge with any time you do bladder installations is you run the risk of pushing bacteria up into the bladder. And so probably aside from urethral pain, the top adverse event from a bladder installation is going to be UTI. And it sounds like you got a really bad one, honey, and I'm so sorry. How long ago was that? How long ago did this happen? How long ago has it been since your symptoms have been worse? Hey, Barbara, nice to see you. A year. That's a long time. You shouldn't be in a flare this long. Have your symptoms improved in the last year? Or are they getting worse in the last year? How are you today, Barbara? How's your IC? Anybody flaring today? Anybody having a wicked flare today? Because we can go through our flare protocol if you want. Okay, Laura, it's gotten worse. Okay, that's not good. Tell us your symptoms. All right, how many times are you getting up at night, hon? You have additional symptoms you've never had before. What are those symptoms? Tell us about those. What are those additional symptoms? You have sciatica, pain shooting down your leg, pain with sitting that gets better with standing. What are your other symptoms? Burning with sex and when weeing. Okay, so let's be really specific then. Where is it burning? Uh-oh. Is it burning on the inside or is it burning on the outside of your skin? Because I will tell you that symptom of burning is either associated with dryness, estrogen atrophy, dryness in your vagina, or it's associated with very, very tight muscles, muscles that are working hard or muscles that build up lactic acid. If you remember when you were a kid and you had to go run around the track at school, and you'd get around halfway or 3/4 of the way around the track the first time and your legs would start burning. Well, that's what happens when muscles are working hard. Muscles that are working hard produce lactic acid. Lactic acid causes a burning sensation. So we have to figure out which one you're having. So let me ask you a different question. So Laura, does your urine feel hot when you're peeing? Does it feel like it's burning you as it's coming out of your body and it's crossing your vulva? We call that urine burn. So let's try to separate this from pain with intimacy versus pain when urinating. Well, Laura, not so fast. Not so fast. Does your urine feel hot? Okay. How old are you, hun? I can't tell by your picture, by your profile picture, how old you are. Generally, when we see urine burn, we're dealing with the first signs of perimenopause or birth control or Lupron. Okay, girl, you're there. You're there. I mean, it's happening. It's happening now for you. I kicked into perimenopause at 45. Laura is 43. It is that process of reverse puberty is slowly but steadily happening. And one of the very first things that we look for is urine burn, where your urine feels hot as it's coming out of you. And the best thing that you can do is, number one, maybe use a little bit of V Magic or coconut oil, because remember, the skin is meant to be moist. And the fact that it's hot, that just means your skin can't defend itself as well. And so using something like V Magic on your vulva before you urinate can give you a little bit of an extra protective coating. This is just a very simple ointment. I don't know if you can see that. You can see that. It's like the perfect consistency for the vulva. It's not sticky. It's not sticky like Vaseline. You can see. And that's kind of what we want. That's kind of what we want on that skin down there. And that will give that skin a little bit of protection. Okay. Yep. So Laura said the burning is a lot worse with sex. Okay. Try to be specific. Where is the burning that occurs with sex? Is it vaginal burning? Is it rectal burning? Or is it burning on the outside? Is it burning on the inside in your vagina, or is it burning on the outside during sex? That's what we're talking about, is during sex. Elise says, hope I'm not, Elise, you're fine. If an antispasmodic, anticholinergic med like Miratric are helping with symptoms, does that point to one subtype over another? Yes. Well, yeah, I think so. I think that's pointing to bladder wall driven. Okay, so Laura says the burning is on the inside. Does the burning go away quickly? So is the burning only happening during intercourse? And let me say it a different way. Does it start with intercourse? Does it start with penetration? if you have pain with penetration, it does not start with penetration. Does it start like 4 hours after sex? We need to Zoom. It's hard to do it this way. So if you have straight after and during, okay. Have you had a pelvic floor assessment, hun? If you have vaginismus, if you have hypertonic pelvic floor muscles, tight pelvic floor muscles, then, okay, you have had a pelvic floor assessment. What did they find when they did your pelvic floor assessment? Were your muscles tight? And have you done any pelvic floor physical therapy? Isabel says, just had a urine culture. It was white blood cells. Does that mean Hunner's? Not at all. Most of us have white cell dominant. Not worried about white cells so much. And I can explain that in depth, but let's deal with Laura here for a moment. So Laura, there are two logical things we're going to look at. Number one, if your pelvic floor muscles are locked down super tight, and I have my model right here, right? All right, where's my, okay. So I can do it this way. Okay, hello, hips. Hello, skeletal muscles. So remember that you're, okay, so hold on. So when we think about what's inside our pelvic cavity, it's probably one of the most busy parts of the human body. And the pelvic cavity is the center, it's the core of the human body. It's where the torso meets the legs. Your hips carry the weight of your torso. And inside this small cavity, there's a hell of a lot going on. We've got your urinary tract, we've got your reproductive tract, we've got your bowel, right? Gastrointestinal tract. We've got giant blood vessels that come through your pelvis and go down into your legs. We've got monster nerves, big chunky nerves that go through. As Dr. Weiss says in his book, nothing operates in isolation. Everything influences each other. And that's where Western medicine really fails the pelvic pain patient, because doctors play in their sandbox. If you've got symptoms and you go to a urinary tract, odds are they're going to focus on your urinary tract. And they're not going to look at, hey, well, do you have something going on with your muscles that can mess with your urinary tract? The same is true for a gynecologist. If you go with pelvic pain, they're going to assume uterus or vaginal. They're not necessarily going to look beyond that system. So you just, you're in what I call the chicken versus the egg dilemma, kind of, sort of. And that is, which comes first, the bladder or the pelvic floor? They're both involved. That's a little off topic. So let's get back to the skeletal muscles here again. These skeletal muscles, they're called skeletal muscles for a reason. They're all about helping you move your body. They play a critical role in you walking, opening and close your legs, etc. These are big, meaty muscles. They're flat muscles, but they're meaty muscles. They are important muscles. They also happen to be the only skeletal muscles that in the human body that control major bodily functions. Because at the bottom here, even though I'm missing this piece, if these muscles are tight, well, okay, so the pelvic floor muscles have 3 holes in them. They've got a hole for the urethra, a hole for the vagina, and a hole for the rectum. And if these muscles are tight, what are they going to do? They're going to squeeze the urethra. They're going to squeeze the vagina, and they're going to squeeze the rectum. So, getting back to that chicken versus the egg dilemma here, for many of you, IC is actually began after a pelvic trauma of some type, falling on your tailbone, breaking your tailbone, or being raped tragically, or being an athlete, being an old athlete like I was, a young athlete with a lot of injuries, or being in a car accident, or having a very big baby. You have no idea you have a muscle injury, but every time you fall, for example, you damage muscle. You know how when you fall and you get a bruise on your butt, on your hip? Well, that's you've fallen so hard, you've broken blood vessels. So not only are blood vessels are broken, but muscles are broken. Muscles are damaged. So every time you have a trauma, we have weakened muscles. We have trigger points. Now, you're young, you're resilient, a couple days later, it's over and you don't think about it anymore. You don't necessarily understand that there's a legacy to all these early traumas, and that is muscle weakness and potentially trigger points. And then one day you get frequency urgency and you call the doc, hey man, I think I got a bladder infection. Doc goes, okay, let's do antibiotics. They don't work. You go back to the doctor. Doctor goes, maybe you need long-term antibiotics. And they give you long-term antibiotics for a year, 2 years, 5 years. They don't work. You're still having problems. You go back to the doctor, and the doctor goes, well, maybe you've got overactive bladder. Let's put you on some ditropan, some Detrol, some Mirvatrix. They don't work. And eventually you go back to the doctor, and the doctor goes, hey, I really hate to break it to you. I think you've got this incurable bladder disease called interstitial cystitis. Here's some Elmeron. Here's a diet. I'll see you in 6 months. And you want to get better. I was working with a patient who did Elmeron for 17 freaking years. And she was still really struggling with symptoms. Obviously, the Elmeron hadn't worked for her at all. As our new guidelines say, if you're not responding to therapy, or if you're getting worse rather than better, stop what you're doing, take a step back and revisit the diagnosis. We don't want you to waste 5, 10, 15, 20 years doing something that's not working. And ultimately, in the end, the pelvic floor trauma patient is never going to get better on bladder therapies, because bladder therapies don't fix the underlying problem. Because the underlying problem with pelvic floor is ischemia. You've never heard of the concept of ischemia, ischemia, ischemia. Ischemia is oxygen deprivation. It means that blood flow is compromised. It's restricted to an area of the body. So if your bladder is supposed to get 24 or 28 units of blood a day and it's only getting 10, are you going to have a healthy bladder? No, you're not. And if you had that injury 20 freaking years ago, you've been in ischemia for 20 years, you can damn well bet your bladder is going to be pretty darn vulnerable. But bladder therapies are not going to fix that. Our therapeutic priority is to restore blood supply. And the way we do that is with physical therapy. And if you look at the new AUA guidelines for IC that were released last June, there's only 2 recommendations. Everything else are options. Recommendation number 1, at the very first appointment, check somebody's pelvic floor muscles. And if they're tight, for God's sake, send them to physical therapy. Because now we understand the long-term toll of tight pelvic floor muscles. As long as those muscles are tight, your blood supplies and your blood circulation is going to be compromised. So how do we differentiate between bladder symptoms and pelvic floor symptoms? Well, bladder wall patients, the pain is very sharp and shrill. It feels like razor blades in the bladder. So as our bladder fills, and when we ask that question, when is your pain the worst? Before you pee or after you're done peeing? If you're in agony, the fuller your bladder gets, and as soon as you pee, you feel massively better, then that points us to the bladder wall. But if your pain is worse after urination rather than before urination, that points us to the pelvic floor. If you don't have pain as your bladder fills, that tells us you've got a healthy bladder. Or I was working with a gentleman early this week who inherited a weird a very weird neurological disease, and he had no feeling in his bladder, but that's extremely rare. Okay. So, so pain after urination, delays in your ability to start urinating. If you can't start your stream for 5, 10, 15, 20 seconds, but you can't release that urine, that's because your muscles are tight. When you urinate, do you ever feel like you're peeing through a needle? Called the urethral stricture. That's because levator ani muscles are tight. And Laura, constipation is an absolute symptom of tight pelvic floor muscles. So you have them reversed. You're saying that constipation is affecting your pelvic floor. Well, there's a very good chance it's your pelvic floor that's affecting the constipation instead. I mean, that's a guess, but that's a really reasonable guess. Mary says, is there any way to heal Hunners naturally? I also my doc says I need a hydrodistension to diagnose IC and ulcers, but 3 others said no, they can see them clearly on a cystoscopy, which is so confusing. Mary, there's a special type of cystoscope called a narrow band imaging, narrow, like a narrow gauge railroad, narrow band imaging. So if you have a urologist who has narrow band imaging, they will absolutely be able to see Hunner's lesions, and you will not need to have hydrodistension. However, to treat the Hunner's lesions correctly, you need the hydrodistension so that they can inject the lesion with some steroid like triamcinolone, or they can cauterize the lesion. Those are going to be the 2 most effective ways of treating a Hunner's lesion. But we're getting more and more success stories with hyperbaric oxygen therapy, which would be very natural. Nothing invasive at all, other than you being in an oxygen chamber, and that pushes oxygen through your bloodstream. And either at our meeting last week or the week before, we had a patient who came in who had just finished 3 months of hyperbaric oxygen therapy for her Hunners, and she was doing amazingly well. She was very, very happy. Now, another thing about pelvic floor, when we think about pain with intimacy, so for a man with pelvic floor dysfunction, the worst moment of sex is the moment they ejaculate, because that is when their strongest pelvic floor spasms happen. For a woman, the act of sex itself is usually not that bad. The flare kicks in about 4 hours later, and it will last about 18 hours. And that is when the female body goes into a series of very gentle pelvic floor spasms to help sperm the egg. And so for the typical female, quote unquote, pelvic floor patient, the pain is worse the day after they have sex. And it's a short-term flare, but it's a flare nonetheless. And for flares like that, having a muscle relaxant on board, like a vaginal Valium suppository or some Flexeril, is a really great way of nipping that pelvic floor flare in the bud. Okay, so again, Laura, did you do pelvic floor physical therapy? Anne says she went to a pelvic floor and got exercises for constipation. And I did this morning. I always know when my pelvic floor is starting to get a little tight because I start getting some rectal pain. And it gets a little bit harder to have a bowel movement, which was kind of this morning a little bit. And so what I do, just to credibility test that, I run my finger along the inside of my butt cheek, not on my rectum. I'm about an inch or 2 away, but on both sides. So kind of like this. So I push my finger into the muscle, and I just want to see how tender the muscle is. And my muscle was very tender this morning on both sides, to the point that it actually burned for about a half an hour afterwards from me pushing in on that muscle, which tells me I need to do my pelvic floor work tonight. Isabel says, how do you know if you have the pelvic floor subtype? Well, again, it's about your symptoms. Can you urinate right away, or are you hesitating? Do you have pain after urination as compared to before urination when your bladder's full? Do you have pain with intimacy? Do you have sciatica? Do you ever have pain that shoots down your leg? Do you have pain that gets worse when you sit down, that gets better when you stand up? Those all point to muscles. Laura says no. Chloe says, your last live, you spoke about the mucosa of the bladder. Does it regenerate, or once it's gone, it's gone? If it does regenerate, how long does it take for it to regrow? That's a great, great question. And so what you're talking about is this. So this is a three-dimensional picture, well, a side view. It's not three-dimensional. No, it's not three-dimensional. It's a side view of the bladder wall. So we have a mucosal barrier right here. And of course, it's not blue in your body. That's just for educational purposes. Then we have the urothelial cells here. And then underneath the urothelial cells, we have blood vessels, which you can see right here. And we've got nerves. And so your question is, does the mucosal layer regenerate, or once it's gone, it's gone? If you give it estrogen and you're a woman, it will regenerate. These cells need estrogen to produce this mucus, the glycosaminoglycan layer. So when you give these cells, when you give that skin estrogen, that estrogen is immediately absorbed. Those cells get thicker, they get plumper, and they start producing your own natural mucus. The far more important question is, how long does it take for one of these cells to be replaced when they're damaged? These are the largest single cells in the human body, and they are the slowest single cells in the human body to regrow. I attended a class years ago about this because it's still one of the fascinating questions. We call them basic bladder studies of learning how the bladder does certain things. The guesstimate was that it takes 2 weeks for one of these cells to be repaired. And I think it's kind of a bottom-up approach, but I'm not sure. I honestly haven't read much on it in the last couple of years. But just understand, it's the slowest. These are the slowest healing cells in the human body because they're the biggest cells in the human body. And the problem here is that one of the reasons why they're so slow, and is that it's an adverse environment because you got frickin' urine and all the toxins in urine irritating this. That's why we have a gag layer. The gag layer prevents these irritants from reaching down here to these cells. So it's a hostile environment for cells to regrow, especially, God forbid, if you're drinking even 1 cup of coffee a day. 1 cup of coffee a day will destroy the next generation of cells. So every time you cheat and you have a cup of coffee or a soda, you set yourself back 2 weeks worth of tissue growth. If you can just let the coffee go for 6 months and this tea and the soda and, all the other irritants, the multivitamins, vitamin C, etc. If you just let that go and stop irritating the hell out of your bladder wall for 3 to 6 months, you're giving your bladder a much better chance of building new tissue. But if you're continuing to drink 1 cup of coffee a day, your bladder will never heal. It will never heal. You will destroy that healing process every single day because those little stem cells that are diversifying and trying to become those big cells are extremely vulnerable to acid. And that came from a lecture I attended at the National Institutes of Health taught by Dr. Anthony Schaefer. So we think it's very important that you create an environment to support healing. And that means if you've got a wounded bladder, if you want your bladder to heal, you got to lose all the acids first. You got to lose the irritants first and really give your bladder a chance to grow that new tissue and try to repair that area and try to produce more mucus. And then in 3 to 6 months, you can potentially try a true low acid coffee again, but you're going to have to be, careful. We have, you can see on the shelf behind me, Dandy Blend, which is a fabulous herbal coffee that will not hurt your bladder at all. Dandy Blend is fabulous. I live on that stuff. In the hot summer months, I make frappuccinos. I drink 2 or 3 of these a day, Dandy Blend frappuccinos. So ice, Dandy Blend, water, little bit of coconut milk. That is my summer drink. So Loretta says, Jill, can you discuss the vagus nerve? Can some of these problems begin in the cervical spine with the vagus nerve being involved? Can you enlighten me? By the way, I have very tight pelvic floor muscles, but my bladder pain is on filling with relief upon urinating. No problem starting my stream either. This is the opposite of what you're saying. I'm confused. Well, honey, there's a short-term reality to tight pelvic floor muscles versus a long-term reality of tight pelvic floor muscles. So if you fell and broke your tailbone, okay, your muscles are going to be tight to compensate for that for a period of time, couple months. And are you going to have urinary symptoms from that? Probably not. And unless it's an old long-term injury. The problem with pelvic floor muscles over the long run, tight pelvic floor muscles, is you enter ischemia. It is impossible for your bladder to be healthy if it doesn't have good blood supply. And if you have very tight pelvic floor muscles, those tight pelvic floor muscles are squeezing your blood vessels and putting you into a condition known as ischemia. So, of course, your bladder wall is going to break down. Your bladder wall is going to break down if you do not give the bladder good blood supply, good nutrition, and good oxygenation. So it's kind of like cause and effect. Why is your bladder wall broken down? Well, number 1, estrogen atrophy. Number 2, chemical injury. Or number 3, ischemia. So for anybody who tells you you have very tight pelvic floor muscles, that is not healthy. You need to be in pelvic floor physical therapy because we have got to restore proper blood supply so that your bladder wall gets the nutrition it needs and the oxygen it needs to heal so that you won't have pain on bladder filling. Does that make sense? Sometimes I'm good with my words and sometimes I'm not. Today's kind of a medium day. So Mary says, can you just tell me if you can heal ulcers with anything other than fulguration or steroid? Yeah, hyperbaric oxygen therapy. Hyperbaric oxygen therapy. Mary says, coffee not so easy. It's addictive. Girl, I know. I love coffee. I love this. There's a thing about coffee I don't like, except that I end up in the hospital every time in the emergency room with my heart going freaking crazy. And the thing is like Starbucks was my home, especially if we were evacuated from fires. You know, I knew I could go to Starbucks and sit there and have a frappuccino and just breathe if we were waiting to see if our home burned down. But unfortunately, as I've gotten older, I've just gotten much more sensitive to caffeine, and I keep ending up at the ER with PVCs and heart arrhythmias. And finally, the last one was last year or 2 years ago. And the ER doctor was just like, Jill, you're done. You may not have coffee again in your entire life. You are too sensitive. It is going to hurt. It is hurting you. It is not going to hurt you. You're here. It is hurting you. You're throwing PVCs every couple of seconds right now. Your heart is so freaked out about the coffee. so reactive to the coffee. And I hated that. I hated the feeling of that. I hated the pain of that. I hated the fear. And so it's like, okay, I'm done. I'm done. I have not had coffee since the last time. Have not had coffee. I go to Dandy Blend. It satisfies the coffee craving perfectly. I can make a latte with it. I can make a frappuccino with it. It's not going to hurt my bladder at all, and it's not going to hurt my heart. So, fear sometimes fear is a very useful emotion, because it makes you sometimes make better decisions. I had to let Starbucks go. I just can't do it anymore. Isabel says, my urine stream is fine and not hesitant. Can it still be pelvic floor? Yeah, it can still be. What that means then is that maybe your levator ani muscles are good, but maybe your piriformis muscle is not so good. The piriformis muscle doesn't influence urination like the levators do. So if your urine stream is fine, then your levator ani muscles are probably pretty good, but you still need a pelvic floor assessment. And let's see if we can figure out if anything else is going on down there. Loretta says she's in pelvic floor physical therapy already. Good. Keep doing it. And Loretta, listen, the most important thing you've got to ask that physical therapist is, are your muscles slowly but steadily getting better, or are you always going back into muscle tension? Like no matter what they do, a week later, a month later, your muscles are locked down tight again and again and again. If you're always going back into muscle tension, that's when we need to step back from the muscles a little bit and start studying those things that put a lot of long-term stress on muscles, also known as your bones. I'm getting, and it's so interesting because, I had a lot of trouble sitting years ago, and it was getting worse and worse and worse and worse, right? And finally, and my Kaiser Permanente kept saying, Jill, it's an old muscle injury. And they got it half right and half wrong. It was an old muscle injury. I mean, it was an old injury, but it's not a muscle injury. It's an SI injury. So the reason why I have very persistent left side pain, sometimes very sharp left side pain, is because of my SI joint. This is the joint between the sacrum and the hip bone. So if we look at it on the inside, you can see the SI joint. See the SI joint right there? It's kind of, here, hold on. There's another one right there. You got two SI joints. See that? Now this joint is meant to be very stable. It's not supposed to move. But for some of us, it starts to move, and sometimes it even starts to kind of dislocate, which it did last weekend, last Monday. I had pain walking for a couple of days before it finally went back into position. So until I get my joint stabilized, my deeper muscles down here, which you can see right here, you see these muscles right here? These muscles, and there's just lots of muscles here. Muscles help to stabilize the joint. So because my joint is vulnerable and moves, those muscles are going to stay high until I get some prolotherapy and try to restore the tendons by my SI joint, or the ligaments by my SI joint. And I want to do the ligaments up by my left jaw too. In any case, it's just important to go work with an expert. Let them check your body. Ask how you're doing over time. And if you're not responding to therapy, if your muscles are staying in tension, you need to take a step back and ask them, okay, do you see any reason why that would be happening? Why would that be happening? Are you limping? Are you not walking correctly? For many, many patients, that long-term pelvic floor tension is directly the result of them not walking correctly. They got one leg longer than the other. They've got a foot problem, Morton's toe, Morton's neuroma, etc. Mary says, I think my bladder causes me to tighten muscles. So physical therapy doesn't help me. They confuse this with people a lot. I think it's overprescribed. To be honest, there's no way to tell what's causing. Well, Mary, that's the chicken versus the egg dilemma. Ultimately, which comes first, the chicken or the egg? And for us, it's which comes first, the bladder or the pelvic floor. They're both involved. You are living proof that they're both involved, but one is normally driving the other. And so, if, for example, your symptoms started during chemotherapy, or you were drinking a massive amount of diet soda when you're younger, you would have a chemocystitis, that the chemicals would have irritated your bladder wall. Your bladder wall starts screaming in pain, and your muscles get tight to protect you from that pain. That's called the guarding reflex. So for many patients, the muscles are directly the result of maybe a UTI, chemotherapy, or just drinking way too much coffee and irritating the hell out of your bladder. But that's the smaller group. The larger group are patients whose symptoms began not with a bladder insult, but with a pelvic insult or a muscle insult. And as I said earlier, you have no idea you have a muscle issue. Your first symptoms are frequency, urgency. You're going bladder, bladder, bladder. You're not thinking muscle at all. And they give you the antibiotics, and they give you the ditropin, and they give you eventually the, I hate to break it to you, I think you got this incurable bladder disease. But if you've done bladder treatments for a long time and you're not getting better, then maybe it's not your bladder. Maybe your bladder isn't the dominant problem. Maybe the problem is muscles. Loretta says the muscles go back. My levator and piriformis muscles are nasty. You also have constipation. You have polio as a child, and the physical therapy said that is huge. Absolutely, Loretta. Absolutely. And Mary says, I have a guarding reflex due to pain in the bladder, likely estrogen atrophy. Absolutely possible too. So the moral of the story is you don't just pick one and treat one, you treat both. If you have tight pelvic floor muscles, you get your tush to physical therapy. If you've got a sensitive bladder wall, then we got to do things to help protect that bladder wall. Here, somebody's calling for me. I'll be right back. A card stay. Hold on one sec. I'll be right back. All right, everything's fine. And I got to put my hair up in a ponytail now. I'm done. It's so annoying. I need to get a cut again. Okay, Cardsi says, I found after pelvic radiation therapy, if I have stool in my sigmoid or rectum, I get pain in my lower back, numbness and weakness down my left leg. I don't have hard stool because I'm now vegan. So Cardsi, that's so interesting. When I was realize, guys, in hindsight for me, this all began when I was in 7th grade and I broke my tailbone. Okay. And I had frequency urgency, but I had a very narrow urethra, which should have been the sign to them that there were a problem with muscles. Then I had vulvodynia in high school, which we now know can be related to tight pelvic floor muscles. Then in my 20s, IBS and some other things. But one of the things that happened in my 20s that was so baffling, and I remember distinctly when it happened, I was laying on my couch reading a book, and I could feel the bottom of my feet tingling. I was just like, what the hell is that? And then like 10 to 15 minutes later, I'd have a bowel movement. And it was baffling until I made the connection because, hello, remember, when we think about this small, narrow cavity, we've got big, giant nerves, but we also have your gut. and we've got your bowel, and we've got your rectum, and they are often proximal. And so what I learned for me is that if I was trying to pass a hard stool, you know what I mean by rocks, and if it just pushed in one location, it tweaked the nerve, which then caused my feet to vibrate. And as soon as I had the bowel movement, and it all went away. So there's a lot of proximity here, and you're kind of describing that. But and now I will say the other legacy I have is that I can feel anything in my rectum, anything, anything. I feel everything. So you know how you have a bowel movement, but you leave like a pee behind that just doesn't come out? I feel that. And it's been that way for 30 years. And that's just an example of really, really sensitive nerves that even, really were just traumatized by the original injury. And for your case, you get pain in your lower back and numbness and weakness down your left leg. Now that, I don't understand that. There's something called a dermatome. And you have to look at the dermatome for where you're getting the numbness and the weakness in your left leg. Hold on a sec. Let me see if I can print out, because I'm not convinced that that's what you think that could be. Let me see if I can. Is that a good picture? Yeah, okay. Here, let me see if I can print this out. Hold on. It's not very big. Let me see if it'll print. Oh, no. Hold on. Let me take a screenshot of this. All right, and let me just drop it into that file new. And this is good for, I think, for everybody, just to try to understand sometimes what can happen here. All right, create. Let me drag the screenshot here. Yeah, there we go. All right. All right, let me print this out. Okay. All right. So, they have mapped where every nerve that comes off of your spinal cord innervates. That's called a dermatome. And so if we look at this picture, and hold on one sec, I need to go back here because I have lost my, okay. There we go. Okay. So if you have pain, like right by your tailbone, you can see right here, that corresponds with S5, sacral 5. If you have pain across the top of your upper front leg, that corresponds to nerves coming out of L2. This is L3. This big blue one right here is L4. And down here is L5. So I think it would be very smart for you to Google dermatome and look at the maps of dermatomes to see if it will correlate with one of these nerve bundles. Because, honey, you might actually have a ruptured disc. So, like for me, it's L4. For me, it's L3, L4 primarily. But I still, still get, every now and then I get vibration on the bottom of my feet, and I correlate that up with tight pelvic floor muscle. A card C says, yeah, now I can feel anything in my rectum. The numbness and weakness does improve after a bowel movement. Radiation therapy is very challenging because it damages tissue. And where they're trying to save your life from cancer, so the use of it makes sense. They don't necessarily help you understand the toll that radiation takes on tissue, not only on nerves, but also really particularly on blood vessels. And so I think it's interesting, though, that you have weakness down your left leg. That's a part I don't understand. And I hope you're working with a neurologist. I think you really need to work with a neurologist to try to localize where that nerve injury is a little bit more. I mean, because obviously you have a nerve injury. And the whole feeling things in the rectum, very annoying. That's why you have gloves and KY on the back of your toilet. You just pop it out. Whatever's bugging you, you can just pop it out. When I started, I've probably been doing that for 25 years now. Once in a blue moon, not often. But I'll tell you that I can at least go to sleep. See, I have no shame. I'll talk about anything. Now, what did I miss here as I was talking? So Isabel's asking what doctor can check your pelvic floor, your gynecologist or your urologist, but they are not trained to do a proper pelvic floor assessment. They're just going to stick a finger in there, and if it's tight, they send you to physical therapy, and it's the physical therapist who does the proper pelvic floor assessment to really try to figure out which muscles are messed up for you. Are they shallow muscles? Are they deep muscles? It is on the left side, is it on the right side? Your regular doctor is not trained to do that. A physical therapist are the ones who do that. Carrie says Cipro can damage mitochondria, the cell replication. Absolutely. Cipro, guys, Cipro is not recommended for UTI anymore. You should not be taking Cipro for UTIs. Anybody who's telling you to take Cipro is wrong. The FDA has very clear warnings now about Cipro causing, they say the risks outweigh the benefits. It can cause tendon issues, but more importantly, it can cause aneurysms. So Cipro is no longer recommended for use for simple UTI. It is only to be used if there are no other medications that will kill that infection. That's when you would think about it. Cardsy says you could be right. Thanks. I'll check the dermatome. I could have a ruptured disc too. I live disabled. The neck pulls to one side. Girl, I have neck tension on this side, which is affecting my left jaw. So I ruptured my L4 during one of our evacuations for fire, and it was our big evacuation. Whereas we were driving away, the fire was 3 houses away from our house. And my elderly father would not leave without his gun case. 70-pound gun case. And I dragged a 70-pound gun case up a flight of stairs. And that's how I ruptured those discs. He now knows that if we evacuate again, we're going to bury the guns in the backyard somewhere. I'm not doing that again because my leg basically started to give out. My leg is weaker. It's kind of shrunk a little bit from the nerve injury. I have to wear a brace on it every day. And with the brace, I can walk and stuff, but it is a very clear nerve injury. I probably should have surgery for it, but Kaiser is not proactive in that way unless I get proactive. Cartsy, yeah, he loved that gun. Yeah, it was a bunch of guns. It was like 4 or 5 guns that he's had his whole life. And he's 100 years old. So, he digs his heels sometimes. Never again. Never again. The other thing he did is he wanted to drive his car. He didn't want his current Crown Vic to burn. He got lost. He can't see. He couldn't read the street signs, and he got lost. Thankfully, I was right behind him. But yeah, we're not going to do that anymore either. I'm going to drive his car down the street, down the hill, and then I will run back home. Anne says, what is given for a UTI? Well, it depends upon what your culture results say, because there's no such thing as an antibiotic, a UTI treatment anymore. There are a lot of different bacteria that can cause an infection. So the first thing they have to do is identify the bacteria. Then they have to do an antibiotic resistance screen to find the antibiotic which will kill it versus those that it's resistant to. And then based upon that, that's when they give you an antibiotic. Mary said, my doc did an exam where she went in through the vagina and touched my bladder. Does that mean that's the source? Not necessarily, because they keep talking about atrophy, so confusing. They share a wall. Yeah, they're right next to each other. I mean, the bladder and the vagina are right next to each other, but more importantly, they all originate in what we call the urogenital sinus. So back when you were a little cluster of cells in your mom's belly, there was one cell that diversified and created the vagina, the uterus, the urethra, and the bladder. Urogenital sinus. That's why they're all so closely connected, and they're also estrogen dependent. Renee says, what did I miss? Oh, a gun case. Yeah, it's just his historic collection. Never again. So speaking on that, guys, there's something came out that I wanted to talk to you about. So hold on a second. Let me find it. Okay. So what have I been saying for the last 10 freaking years about infection? That there's this whole industry that is profiting off of telling women that they're dirty. Oh, you need to douche. You need to use this. You need to use that. You're dirty. And how many of us have endured the oh so humiliating lecture of, honey, are you sure you're wiping correctly? You know, you're supposed to be wiping from front to back, not back to front. If you wipe from back to front, you're going to bring bacteria up to your urethra. You should always be wiping from front to back. And there's this general level of insult and talking down that happens to women with urinary tract infections. You know what I mean. With men, it's different because, the tip of their penis is a long way from their rectum. So they're not going to get that same lecture that women get. But why are there so many UTI? Is it because we're all freaking stupid and we don't know how to wipe? Or is there another source of bacteria that is giving us infections? And guess what? we have yet another research study that has found that urinary tract infections are often coming from meat that we are eating. And so 3 days ago, CNN did, I just want to read this to you. Bacteria from meat could be responsible for more than 500,000 urinary tract infections in the United States every year, a new study says. E. coli is an often harmless bacteria that's part of the normal bacterial environment in the intestines in human and animals, said Dr. Greg Cometer, professor of urology at Stanford University, who some strains can be dangerous, causing diarrhea, respiratory illness, and pneumonia. Researchers have long known of a link between E. coli and UTIs, an infection in any part of the urinary system, including the kidneys, ureters, bladder, urethra. E. coli causes 6 to 8 million UTIs in the US every year. But new research suggests that more of these infections may be linked to E. coli from meat than previously known. Infections can happen when meat with E. coli is not prepared with proper hygiene, passes through the digestive system, and ultimately exits the anus. Because of its close proximity, that bacteria can easily enter the urinary system and cause an infection. Women have urinary tract infections 30 times more often than men do. So here's what the study found. The study from George Washington University, Milken Institute of Public Health, analyzed data from the retail meat samples collected between January of 2012 and December of 2012. Researchers looked at samples of chicken, turkey, and pork from 9 major grocery store chains in Flagstaff, Arizona, and then took blood and urine samples from people hospitalized for UTIs in the area at the same time. It took 10 years to parse the data, including tracking the E. coli's origins, said study author, co-author Dr. Lance Price, a professor of environmental and occupational health at George Washington University, and the founder and director of the George Washington Antibiotic Resistance Action Center. But the dominant strains of E. coli present in 2012 remain the same now. With the findings and a predictive model, research estimates that 8% of E. coli tract infections in the U.S., that's 480,000 to 640,000 cases, are caused by strains from meat. Let's see. The study findings also reveal another facet of the problem, the alarming rise of antibiotic-resistant infections. Most animals in the food industry are given antibiotics, but the overuse of antibiotics in animals breeds resistance. Meat-associated bacteria is known to be especially resistant to treatment. Hello, superbug. This is just the way animals are bred for food. They're going to pass infections to each other, so they need antibiotics so that they don't die, so that we have a good source of protein. But resistant bacteria and meat can then be passed along to the humans who eat it. As these bacteria are becoming more and more resistant to antibiotics, there's more and more infections that are progressing from the bladder to the kidneys to the blood, and unfortunately, people are dying. Cometer believes that researchers should also focus on antibiotic use in animals. Perhaps we need to find another way to make burgers without giving animals excessive antibiotics. And I swear I was watching like 2 weeks ago a documentary on Netflix that was talking, I think it was on Netflix, that was talking about this, where, and this was like 30 years ago, they made the very clear and direct correlation between antibiotics used in animals with the development of these superbugs. And they proposed a very doable plan of reducing antibiotic use in animals. And how do we do that? We get them out of the factories and get them out into the fields. Get them out of the small groups, small pens where you got 100 cows living in close quarters where the infections ramp up. That's why we want to do grass-fed. We got to get these animals away from the factory farm and back out into nature where they can be healthy and they don't need the antibiotic. But no, what happens is when you give the animals antibiotics, they get more muscle. And because they have more muscle, then people will pay more for them. And so the farmers are like, well, we want the most money we can get. And so we're going to use the antibiotics because it gives us a bigger chicken, it gives us a bigger cow. They're not caring about the long term devastation that the overuse of antibiotics is causing. Because the vast majority of antibiotics produced are put in animals, not in humans. So, anyway, buy free range products. And that's why I refuse. I have not eaten a McDonald's hamburger in 30 years. I believe me, I eat hamburgers, but I'm not going to go for that industrial grade meat. I'm going to get my meat from a credible source, from a local farmer, grass fed, which is now available everywhere. So make better choices and might help reduce some of these infections, right? Deborah said, oh my God, I believe it. I'm in horrible pain right now, probably from the beef that I was eating today. Well, beef doesn't irritate the bladder, and it would take it wouldn't, if you ate beef that was contaminated, you're going to need at least 24 to 36 hours for that bacteria to start to grow more to cause an active infection. Deborah, I think it's probably something that you ate with the beef that probably irritated you. Meat in general is not known for triggering icy flares unless you put, a hot sauce on it, or do a pepper coating or a salt coating, something that's spicy. So I'm not worried about meat. You can roast a chicken, you can roast a turkey, you can make homemade hamburgers. That's not going to irritate your bladder to any great degree. It's what you put on the meat that has the potential of irritating it. Make sense? So that article is from CNN. And the title of it is Bacteria from Meat Could Be Causing More Than 500,000 UTIs in the US every year, study estimates. And I think it's far more, to be quite honest. But what's so interesting is they isolated the bacteria from the cows, and then they isolated the bacteria from the bladder infections, and oh, look, they matched. Lori says, I went carnivore. My bladder was never so healthy. It's all about finding where your body thrives. Yeah, I can give you the link. The research, it's not a fake news story from CNN. This is part of their health series. Let me see if I can just give you. Here, I'm just going to give you a link to it. Here, hold on. All right. It was research. Nobody was behind the story. This is not a propaganda story. This is them looking at a new research. I mean, we've been following this for a decade now because we're following the superbugs. And I've shared this story of one of the worst superbugs found. Started outside of a pork farm in Asia where people that ate that pork developed these very severe bladder infections that were drug resistant. Then it was found in Europe. And then this poor woman in Philly, somewhere in there. And guys, I'm sorry, allergies are really bad right now. My hay fever is really bad, so I keep scratching my nose. Um, about 7 or 8 years ago, a woman in Philly or somewhere in that part of the country developed this very, very difficult UTI that was a superbug. And a superbug means that antibiotics couldn't kill it. So these are the most deadly infections. And it was the same DNA profile as the superbugs found in other parts of the world. So what did the American researchers did? They went to our pork farms. And what did they find? This exact same superbug. And so the guy who won the Nobel Prize for creating the first antibiotic in his Nobel Prize speech warned that this would happen. He warned that this would happen, that if you start using antibiotics in abundance, you are creating an environment where the strong bacteria survive. An antibiotic will kill the weak bacteria, but the strong bacteria survive it. They are now resistant to that azithromycin, or they are resistant to that Septra, or that sulfa, or that amoxicillin. And we see the scariest level of drug-resistant infections in countries where antibiotics are over the counter, like India. And so there have been Americans who have gone to India. There was it was a guy from Seattle who was in India, and he fell on train tracks, and he got a wound in his leg, and it ended up being this massive superbug. And they couldn't kill it. So they had to bring him back to the United States. So now we have the superbug introduced to the US population. And so the US researchers had to try to figure out how to kill the superbug. So, this is real. This is real. And I don't have a problem with anybody eating a lot of meat or not. I'm not worried about meat at all with respect to hurting my bladder. I care, but what you put on the meat is going to make a huge difference. I mean, I eat meat almost every day. Myself, I made a white chili last night, which is probably why my dad had a GERD attack. I can't give him that stuff. White chili is chili without tomatoes, but it's got everything else in it, and it's good. And it's good for the bowels. And it's all about beans in this house. Kartsi said, thanks for that study. And just out of curiosity, let's go to the National Library of Medicine here. Hold on. Antibiotic resistance. Oh, look at this. Oh, this is, oh God, the research is incredible here. Okay, so here's the first study from 2021. Antibiotic resistance in E. coli from the poultry environment and UTI patients. And that was in the town of Kerala, India. Here's the next study. Broiler chickens, broiler chicken meat, pig, pork as sources of XPEC-related virulence genes and resistance in E. coli isolates from community-dwelling humans and UTI patients. That's from 2010. Antibiotic resistance bacteria, antimicrobial resistance genes, antibiotic residue in food from animal sources. E. coli ST131H22 is a foodborne uropathogen. Ooh, what is that? Oh, wait. Oh, wait. Ooh, this is a juicy one. God, I got to do an article on this. Hold on. This is cool. Oh, this is the Flagstaff, Arizona study that CNN's talking about. E. coli was isolated from 79% of the 2,452 meat samples and 72% of the culture positive urine samples. 27 meat isolates were ST131 and belonged almost exclusively to that lineage. All but one of the 25 meat isolates were from poultry products. Wow. Holy crap. E. coli ST131 is an important extraintestinal pathogen that can colonize the GI tracts of humans and food animals. Our research suggests that one lineage has become established in poultry populations around the world and that meat may serve as a vehicle for human exposure and infection. Oh, wow. Honestly, it like makes me want to become a vegan or cook every freaking piece of meat massively well done. Oh, incredible. This is fascinating. God, I wish I were in grad school again. That would be so cool to study. My senior project in 1982 was the isolation of drug resistance uh, bacteria. 1982. I don't know, guys. Maybe even when I sell the IC network, I should just go back to grad school. I'll be 70 years old and in grad school because it's just so interesting. It's so interesting. Isabel says, can you have two subtypes? Sure. I have two. I am pelvic floor driven and central sensitization. The reason why subtyping is important is it's for clinical use. Is that when we understand your subtype based upon your symptoms, we know how to focus treatments. And that's important. We need to try to find the best treatment for you. So subtyping, phenotyping is really important because it will help you understand why some treatments are important and some aren't. Because so many of you guys give up on physical therapy. And you're like, well, if I can just take a pill and fix this, I'm just going to take the pill. Not understanding that a pill will never fix tight pelvic floor muscles. We've got to restore muscle health. And we do that with hands-on physical therapy. Renee says, what about fish? I wonder if freshwater or wild caught. Thanks for your study. I had a 2-year-old at 1982. Yeah. Where you were a 2-year-old in 1982? Yes, I'm that old. There's been a lot of discussion about fish also. I mean, I just think for us to make really, really good decisions about what we're eating and especially what we're giving to children, we have to have a very clear understanding of our food source. And I was just reading another paper about this really virulent infection that's normally found in seawater in the south, and it's slowly migrating up the East Coast with global warming that can be deadly. So think about something like tilapia. Tilapia is garbage fish, for lack of a better term. Now, listen, this is way outside my area of expertise, but I think tilapia are kind of like bottom feeders. I'm not sure, but there's always a sense that tilapia is not a high quality meat. Whereas you take a cod or a tuna, you don't see the same food concerns with that. But that said, mankind is outpacing the resources of this planet, and we're causing a lot of damage to food sources everywhere. And when you think about all the crap that ends up in the oceans, and yeah, Marlia says tilapia is very bad. They eat garbage and waste. Thank you. I don't eat fish. I'm a terrible Norwegian. I don't like fish. I would be perfectly happy. Cardstead says, need to worry about ocean contamination with lots of fish in diet, especially mercury. Like I was giving my elderly cat tuna because she could smell it, but tuna is highly contaminated with mercury now. And I had to wonder if that was playing a role in the nerve damage, which eventually killed her. She was very old, though. She was 20. Cartsy said, I can help you if you want lots of plant-based resources here. Cancer opens up your mind and palate. I love learning too. Cartsy, I don't know. There was this, now I don't watch TikTok anymore, and I personally believe it should be banned. That's a whole nother story. I think TikTok is fascinating. There's this really interesting mom feeding her young child food. And rather than making a big mixed, like a casserole, she was trying to inspire flavors. And so on that plate for her baby, her 1-year-old or 2-year-old, there'd be some sliced avocado, some sliced radish, maybe a couple of pieces of chicken, olives, little pieces of flavors, strawberry, 1 or 2 strawberries, maybe a slice of an orange, whatever. And God, that really resonated with me because I personally think that I eat too much food. I don't eat during the day. I eat at night. I can go to town at night. And I don't think that I have enough vegetables in my diet. I think I would be perfectly content to eat rice and sauteed vegetables for dinner every day. But see, I'm not a foodie. I'm an old IBS patient, where I had terrible bowel spasms for years from IBS. So I became accustomed to only eating foods that my body liked. So I have no problems being the same every day. Jennifer Aniston does the same thing, actually. But like a perfect meal for me is like sauteed vegetables, especially with a lot of mushrooms. I love mushrooms on rice or on quinoa pasta. But like I really like sliced radishes. I love peas. I love cucumbers. I love yellow pear tomatoes, the little tiny ones. So little acids, like eating candy. Um, I think the more we can go vegetable based, the better I think for all of us in the long run, because the food industry is terrible. Renee says sea bass. I do not eat tilapia or swordfish. Yeah. Mary says I love bread so hard. I don't. I like Ezekiel bread. Last night I had 1.5 flour tortillas, and I had a cookie, which I felt was too much for me. I have another like 5 or 6 pounds I'd like to lose. But Ezekiel bread is great. I love Ezekiel bread. Cardsy, if you'd ever like to write something for us, I have a website, the IC Diet Project, where we do meal ideas for people who need a low income, and I'm always looking for people who would like to contribute columns to that. And if you'd like to do an article or even a series of articles that talk about going vegan when you have IC and gives tips and strategies, I'd love it. We need more of that. We need more resources like that. Mary says, are yellow tomatoes okay? Of all the tomatoes, yellow tomatoes are certainly the lowest in acid, especially the little yellow pear tomato, a pear-shaped tomato, or the little yellow cherry tomato, or the yellow heirloom tomatoes. In general, with tomatoes, you want to avoid the industrial tomatoes that end up in your grocery stores where they're picked before they're ripe and they're allowed to ripen in the box and in the store. What happens is so we've all had, say, an unripe apple, and you know immediately it's acidic and bitter. And that's part of the maturing process. As that fruit ripens, acid levels drop and sugars rise. And so the best low acid veg and fruit you can eat is fruit picked from the plant at the perfect moment. And so buying Roma tomatoes from the grocery store, they're always going to have a lot more acid in them than, say, you growing your Roma tomatoes at home and picking them exactly when they need to be picked. But of all the tomatoes, we've done articles on this, it's the yellow tomatoes that are the lower in acid than the red tomatoes. And the yellow heirloom tomatoes, like the beefsteak yellows, ooh, those are fabulous, fabulous, fabulous. Also, too, remember that it's all about quantity. You can probably have a slice of a yellow tomato on a sandwich because there's very, very little acid in that slice of yellow tomato compared with, say, a cup of tomato sauce. That cup of tomato sauce is like 8 or 9 tomatoes that have been reduced and concentrated to create sauce. There's a lot of acid in tomato sauce. There's very little acid in that slice of tomato that you can put on the sandwich. Ashley says, can you share the white chili recipe? Ashley, I did actually, Ashley, it's on our website. It's one of our food blogs. Let me get it for you. Hold on. You're just on a different computer, hun. So this computer is on Facebook. That computer is on YouTube. So let me see if I can get that for you. Oops. Okay, it's under news and blogs, and you go to ICM blog. Oh God, allergy is so bad right now. My nose is so itchy. It doesn't help that I was out planting this morning. And when I'm done, I'm gonna go back to the nursery and buy a few more violas. I've got a few holes left. Here it is. Here's the recipe. My white chili does not look like the picture. My white chili has a lot more, it's darker and it has mushrooms in it. And so it's not pure white like this picture, but there you go. Cartsy says, thanks, Jill. I'm no expert on IC, but I can give you doctors' names and researchers. Dr. Britt Goldner, 1, Dr. Caldwell Essinger. Hey, hon, do me a favor, send me an email. But listen, I am so swamped right now. It is ridiculous. I've never been busier than I am right now. So if you could do more than give me names, if you could actually tell me what they've done, that would be really helpful. Mary said that clinical trial you posted, is it only U.S. citizens? That's a question to ask them. For anybody, so I started out this meeting talking about, and I've been saying this for the last couple of meetings, we're going to have a lot of clinical trial announcements this spring because clinical trials are amping up. They're kicking up big time right now that COVID is better. So we did our first clinical trial announcement over the weekend. And it was for a study in Ohio, a phase 1 study of a new therapy. That's quite interesting and encouraging, but it is a phase 1 safety and tolerability study. They need a small number of patients to help them figure out dosing, etc. And so to participate in that study, you're going to actually stay in their facility. They for like 6 weeks. They're going to do a lot of blood draws because they want to see what the medication does. But they will pay $20,000. I've never had a study ever offer that amount. I can't tell you more. You have to work with them. So and ask them questions. Obviously, it's a phase 1 study, which means that they're trying to establish some good safety profile information. So, is it risky? Potentially. Is it seriously risky? Potentially. Have they done previous studies to justify their work? Yes. Have those studies shown anything to be concerned of? Not that they told me. So it's encouraging, it's interesting, and it's something that you could learn a little bit more about. Cartsy says, I live too disabled to type more than this. Love you. Thank you for your work. Wish I could help more. Honey, it's okay. Just do the best you can. So, Mary, you pop them an email or call them and ask them. I had somebody contact me immediately from Israel and asked if they could come and participate. So it's possible. So we'll be doing 2 more big trials, one this week and then and next month, and then another study after that. So we've got quite a few. So if you want to learn more about these studies, make sure you sign up to be on our newsletter list. And when you join our newsletter, you'll get as a gift from us our 40-page flare management guide. Angie said, and if you need any help, email me. Always happy to do so. Thank you, Angie. I wish you were here. I wish you were here because honestly, I would just bring you in, have you answering phones. It's my day. I don't have a lot of time to create new stuff. I mean, like literally my morning is elder care. My afternoons are coaching. And every now and then after dinner, I can actually sit down and actually write stuff. I'm way behind on writing new materials I got to rewrite our book with all the new information. That's my summer project, but a lot of it just stops in its tracks with my parents as they get older. We're having a lot of health crises now. Like literally, my dad was sleeping in the recliner and I thought he had stopped breathing. Like I walked up to him and looked at his chest. Is he breathing? He was. Thank you, Angie. Thank you. I will. I'm just thinking about, I don't have a lot of, well, I'll think about it. It's just, now it's really phones more than anything. All right, guys. Well, listen, we're kind of slowing down here. Does anybody have any other question? Anything that I can help you with? Renee said, only 24 hours in a day, girl. You have a big load with your parents. Yeah, exactly. You are exactly right. And, it's hard. It's difficult. It's hard to see people you love in pain. Very, very hard. All right. Any other questions? Any other questions on IC that I can help you with? If not, this girl's going to go walk and go to the nursery. But I am willing to stay. Thank you, Gay. YouTube, you guys are being very quiet. Any other questions I can help you with? I look at my face and go, I need a facelift. I have wrinkles. Mary says one more question about hunters. Can a supplement or diet help? Oh God, absolutely. Diet modification is everything. If you've got Hunner's lesions, you better darn well be on that diet, because patients with Hunner's lesions are absolutely the most diet sensitive. So if you have Hunner's lesions, you are not helping if you're drinking coffee and soda every day. You're actually hurting it and making the lesions in all likelihood bigger and more painful. So diet is everything for patients with Hunner's lesions. Everything and more. Now, is there a supplement that can help? You know, our research with Hunner's lesions is limited. There is a kind of a general consensus that bladder installations are not particularly helpful with lesions. Elmeron, not particularly helpful with lesions. Not what seem to be the most effective for lesions are lesion-specific therapies like steroid injections into the lesion, things that will reduce inflammation. I think if I had lesions, I would be trying to change my diet to avoid foods that cause inflammation. I would lose sugar, lose coffee, things like that would just calm the skin down and calm inflammation down. And I think I would be, just as a guess, if I were looking at the supplements, I might be interesting to try Bladder Builder, really, because it might help coat the bladder a little bit, but more importantly, it has the PEA in it for nerve pain. But I've got no data to support that. There's no data to support any supplement for Hunner's lesions, none. Allopath would be very compelling, though, because the aloe might be soothing to the lesion, combined with the PEA to calm nerves down. So I think it might be interesting to do maybe 6 weeks on Bladder Builder and then maybe 6 weeks on Allopath, just out of curiosity, to see if one was better than the other. I wish that there was money available to do studies like that. There's just not. But both of those are compelling. I mean, I think given the high level of pain, I mean, I think that PEA would be the priority. So I would pick Allopath or Bladder Builder just as a shot in the dark. You know, it's just a guess. And please remember, I'm not a doctor. I can't give you medical advice. My job is to educate you, inform you, and then kick you in the butt and get you back to your doctor. And so if you have ulcers that are not treated, for God's sake, go back to your doctor and ask him how he proposes to treat them. And do your due diligence. Come to our website and read the section on Hunner's ulcers and read the section on research. Read the section on what the American Urology Association says for how lesions should be treated. So that it's, because if you've got a doctor who diagnosed you with lesions and didn't treat them, that's almost criminal or malpractice. Lesions respond well to lesion therapies, and that's what our guidelines say. Remember, 2 recommendations in our guidelines. Everything else are options. Recommendation number 1, the patient has tight pelvic floor muscles, send them to physical therapy. If you suspect the patient has Hunner's lesions, check for the lesions and treat them immediately. Those are the 2 things. We don't want to wait a year, 2 years, 5 years, 10 years to treat lesions, because that patient is going to suffer. We want to treat lesions as soon as we find them. So anyway, that's according to the American Urology Association. All right, you guys. Well, listen, I think you're done. So I think that means I'm done. Hopefully I will be back on Friday or Thursday or Friday on Facebook and next Sunday. I appreciate all your good wishes. And for my folks, every day is an adventure. And just know that, you know, if you find these meetings helpful, come on over to the IC network. And if you can, if you're need heating pads or supplements or anything like that, buy them from our shop, because that's what keeps all this going. All right. Or you can become a member and get our magazine. But anyway, all right, you guys, I will see you later. Have a good one. All right, I'm going to say goodbye to Facebook first. All right, Facebook is done. And let me turn off my streaming software. Stop recording. There you go. All right, YouTube, I will see you guys later. Have a good one.